Welcome to our next episode of DecentMed Showcase, Robust Health Advocacy. Today we're here with Angela Forrest, the founder of Robust Health Advocacy. We're going to talk about her work with SIBO, gut health, trauma release, functional medicine, and personal health advocacy. Angela, introduce yourself.
Hello, everyone. I am the founder and the senior health advisor for Robust Health Advocacy. I coach, I'm a holistic health coach essentially, and in my coaching realm, I focus on supporting high-performing female entrepreneurs and career-driven women who find themselves as they prepare to really ramp up and enter the next phase of their lives, dealing with sometimes debilitating symptoms tied to the loss of estrogen. So entering perimenopause, menopause, and postmenopause, dealing with a lot of symptoms that they may not be getting the type of treatment and care from their doctors that they expected when they actually talk about their symptoms. So I work with these women. I help them regain clarity, balance in their lives, address the symptoms so that they can actually do the great work that so many midlife women are doing at this stage. I should note that I should also note, I do training for groups related to these core issues that Samuel mentioned, particularly personal health advocacy and stress and trauma release, as well as gut health. A lot of people have gut problems.
Thank you for sharing. So I want to start with personal health advocacy before we dive deep into some of the conditions that you work with. So what is personal health advocacy?
Yeah, so in a nutshell, personal health advocacy is about helping people understand that they have agency in their interactions with their medical professionals. That because you live in your body every single day, you have a wealth of knowledge about your body that people who don't do that don't necessarily have. And you can use that knowledge as well as knowledge on the internet through well-vetted research, which I specialize in providing, to learn about your health conditions, to better understand your body, to go into your interactions with your healthcare professionals informed and empowered, with the ultimate goal of ensuring that you receive the best care possible. And I would add that for women in general of any age, but particularly midlife women, it can sometimes be a challenge for women to be seen and heard, for their symptoms to be taken seriously by their healthcare professionals. And so this is where personal health advocacy can make a huge difference in helping not only reduce the time it takes to actually address healthcare symptoms, but in some cases, it can even be life-saving.
Wow. Can you talk about some anecdotes in how personal health advocacy has helped women? Because something that's interesting to note that you brought up, and that was echoed at our roundtable yesterday, is that when it comes to the healthcare system, typically they're not focusing on the woman when it comes to testing products, when it comes to pharmaceuticals. So a lot of women don't have advocacy, and that's just one example. But can you touch on some examples that you've seen in your practice?
Sure. So in working with a client most recently in her 70s, and this is a pretty powerful, I would say, example. I was looking at her labs. So she had gone to her doctor, who's a conventional healthcare practitioner. Her labs had indicated that she was positive for a UTI, and I'm trying to remember the acronym. UTI is a urinary tract infection. She tested positive for having a urinary tract infection. Now, at the same time, it also said in her medical record that they weren't going to treat it. And the reason why they said they weren't going to treat it was two reasons that they gave. They said that she was asymptomatic, so she had no symptoms. And the other reason they gave for not treating this UTI, which I should note, the patient has stage 3 kidney disease. If you're familiar with urinary tract infections, the danger of urinary tract, one of the dangers of urinary tract infections is that they can damage your kidneys. Okay, so she already has a kidney disease. Okay, so the other thing I wanted to say is that the other reason that the healthcare practitioners did not recommend that her UTI be treated is because they were referring to, and I don't want to get the association wrong, but essentially it's an association of urology professionals, and there's probably several of them, and I'm not going to name the one that put out the statement, but essentially it was a professional organization of urologists that put out a statement back in December of last year where they basically said, if a patient has been diagnosed with a UTI and they are not having symptoms, then you should not prescribe antibiotics to them. And so this is what my client's doctor had cited as reasons. Now here's the situation. The client had symptoms of a UTI, okay? She had urinary urgency, which is a common symptom of having a UTI. So right there, she needed to be treated. Number two, as I mentioned, she had stage 3 kidney disease. So she was at high risk of having more damage, additional damage to her kidneys by not treating this UTI. So what I did in my role as a healthcare, as a health coach, is that I just saw that post there. Yeah. I mean, professional recommendations are saying that it's harmless. I would say from the functional medicine perspective, no infection is harmless, whether or not it causes symptoms or not. And again, the patient had symptoms. The patient had urinary urgency. She needed to urinate and empty her bladder. And that is that's like the number one symptom of a UTI. The steps I took to help my client, I consulted with a specialist, another specialist on the functional medicine, integrative health side. Because my patient had very adverse experiences with antibiotics, which is one of the reasons why I was working with her, we made a decision that we would treat her, or she would have the option. She could use the option to be treated with herbal antibiotics. The specialist I was working with prescribed an herbal antibiotic supplement for her to take. And bottom line is, I was adamant that her urinary tract infection be treated. The diagnosis was off. She did have symptoms, and she had stage 3 kidney disease. So this is where advocacy, like I'm saying, can make a huge difference. Having another person step up and say, no, you should be treated. You have an infection. That infection can not only damage her kidneys, it could turn into sepsis. It could turn into systemic infection throughout her body, leading to organ shutdown. So when I'm talking about personal health advocacy, this is a serious issue. This is a serious thing. This is a skill that people really need to have, of all ages. And you can not only use it for yourself, you can use it for your loved ones, right? For your family members. Having somebody in the room who is, with particularly an elderly family member, asking those very direct questions, letting the practitioner know this person has people who love them, and we are going to advocate and make sure that our family member is going to get the best care. So I developed an entire course on personal health advocacy because of my own personal experiences with dealing with the healthcare system and being dismissed, ignored, denied, and having wrong diagnoses issued to me, and me having to step up and correct that and fix that and make sure that my health was secure.
And to that point, looking at your website, you offer what's called client engagement. It's compassionate, collaborative, personalized, innovative, research intensive, and evidence based. Can you touch more on what is client engagement and how does it play a role in patient advocacy?
Client engagement basically means meeting people where they are. It means that you're an active listener. It means that when people talk about their symptoms, you believe them. You don't dismiss them. You don't gaslight them. You actually sit with them and acknowledge that they're having the symptoms. I consider a person's symptoms, their understanding of their body, and their innate knowledge that things are not working right to be a diagnostic tool. It is not a liability. It is not a burden. It is not correct. It is the person's lived experience. Lived experience, I would say, honoring that lived experience is the number one quality of client engagement that I actively work on with my clients. And the care that I provide, the coaching support I provide is highly customized. We are all very different. Our biology can be very different. The way we experience life can be different. And so, from my perspective, providing health support, and I do work with practitioners. It's important to know I do work closely with practitioners. Providing support in conjunction with a healthcare practitioner for a client should be as individualized as that person. One size fits all medicine does not work well. And we see time and time again how patients fall through the cracks because either there's an assumption made about that person based on external characteristics, race, gender, or other characteristics, or, particularly when you're talking about women, you mentioned early on, Samuel, about the fact that women are not really incorporated, it seems like, fully into healthcare solutions. That really stems from, one of the factors is that it stems from women not being included in health research. This has been an ongoing issue since really the start of modern medicine in the United States. Women have simply not been included in research. And some experts use the term tiny men. Women are treated like tiny men when it comes to receiving pharmaceutical drugs, devices, and other healthcare interventions. And women are not tiny men. Women are women. And our biology is different. And so client-based care is just really seeing that person as a whole person, understanding that all these different elements of life that we experience in an integrated fashion, we experience life with our bodies, minds, and our spirits. And when one of those areas is not working well, it is going to affect the other areas. It's not piecemeal medicine. It's not, let's look at a symptom and give you a pill to treat the symptom. It's looking at root cause issues so that the healthcare challenges can not only be resolved, but they can be, the healthcare outcomes, the positive healthcare outcomes can be sustained. Giving people the tools is another part. Giving people the tools to heal themselves is another really powerful part of this. 80% of all chronic disease is preventable, and it is tied to lifestyle and behavioral change, behavioral habits, right? The things that we do, the things that we eat, how we engage with the world, our stress level. These are all very big factors in whether or not people develop a chronic disease or overcome it. So again, taking in all of a person's life, that's what I do. I spend an extensive period of time with clients, listening to their stories, understanding the things in life that have impacted them. And I take all of that into account when I begin to kind of assess and identify areas of their health condition that we need to prioritize and address. And this is the way that people get real relief. This is how people can overcome, and I include myself in this, overcome conditions that they've suffered with for 20 and 30 years. There's no quick fixes. You can't hack your way to longevity. You can't hack your way into recovering from a long-term chronic disease. So we take the approach where it's one step at a time. We're going to look at your entire life, all of your trauma, all of your stress, all of your relationship challenges, and we're going to incorporate all of that into developing a treatment protocol, working closely with practitioners so that you feel respected, you're heard, and you're seen, and we can get you on the road to healing.
Something you said that was very interesting was one size fit all medicine does not work well. And we talked about in our summit yesterday the benefits of testing, specifically for women. What kind of tests do you incorporate in your practice?
That's a good question. So, again, it really depends on the symptomology, the issues that the person is dealing with. I would say because I do specialize in hormone balancing and assessment as well as gut health. The big tests related to gut assessment would be for me starting out with having people get tested for SIBO, which is small intestinal bacterial overgrowth. The main reason for that is usually because of the symptoms that they have and the fact that SIBO is really common. Many people have SIBO and they don't know it. So I usually will have a person, particularly if they are presenting with chronic long-term digestive issues, bloating, constipation. I will encourage them to get a SIBO test. And I typically rely on qualified practitioners to evaluate the results of that test. When we're talking about hormones, particularly for women who are in perimenopause, menopause, and postmenopause, I like to recommend that women get tested, get their hormones tested, right? There's a lot of different hormone tests out there. The one that I have used myself personally, and I do recommend, there's a couple of other good ones, but the Dutch test is probably the best well-known test. It is a urine test. It's very comprehensive. It doesn't just look at the reproductive hormones. It looks at virtually every hormone in your body and how those hormones are interacting with each other. And it's very accurate because of the way that the test is gathered using urine. It just allows for a very comprehensive assessment. Now, there are other tests that use both urine and saliva to test hormone levels. And I have been informed by the practitioners that I work with that those are probably the best quality just because they are using both urine and saliva. I think it's important to note here that a lot of women who start having symptoms in perimenopause that continue into menopause and postmenopause, who make a decision to consult with their doctors, will be told that they should get a blood test. A blood test is not the best test to use when you're testing hormone levels. It is not as accurate as testing urine or saliva. If I were to tell people watching this video, one thing that they, if I want them to remember one thing that I say about testing, I would say this about the hormone testing. A blood test is not going to give you the type of information that will help you you and your practitioner, I should note, help you and your practitioner make educated decisions about how to address your perimenopause, menopause, and postmenopausal symptoms.
According to statistics, SIBO is very common among IBS patients. Studies show an overlap ranging from 30% to over 60%. So diving deeper into SIBO, can you talk about your protocol for individuals that come to you that have SIBO?
Yes. So my protocol, I would say, is a little bit different than conventional doctors as well as many functional medicine practitioners. I say that because I've had SIBO and I have had it treated, and I've worked with clients to treat their SIBO. So typically what I'll do, once they get the SIBO test, which is a breath test, you basically blow into a device. They do the SIBO test. If it comes back positive, I am very much, because I'm a health coach, I'm very much going to encourage the client to do what's known as an elemental diet. I'm not going to recommend that they start with antibiotics. Now, I should say I'm flexible. If the client wants to do antibiotics and they haven't done antibiotics yet, I would probably say, I will let you decide. I will always let the client decide, obviously, but I would say, you choose what you would like to do. I'm not going to say that you should do the elemental diet. However, if the patient has already been diagnosed and gone through one or more rounds of antibiotics and has not been successful in eliminating the SIBO, at that point, I would recommend that they get on an elemental diet. What is an elemental diet? It's essentially a high nutrient liquid diet. And typically people would do the elemental diet for a minimum of 2 weeks to make sure the SIBO is eradicated. You can do an elemental diet for up to 3 weeks. I have talked to several functional and integrative health practitioners who have told me they don't recommend the elemental diet for clients, for their patients. The reason why is it can be difficult. It is not just a physical process, it's a whole psychological mindset process, because the fact of the matter is you're not eating solid food for at least 2 weeks. That can be a real challenge for people. Historically, the powder that was used to make the liquid tasted very bad. That was another factor. Since then, they have come up with what they call palatable elemental diet formulas. I'm a health coach, so I can work closely with patients and clients to guide them through the logistics of successfully completing an elemental diet. Now, here's the part that really people should pay attention to. If you go the route of treating SIBO with rifaximin, which is the most common antibiotic, there are others that are used, but rifaximin is the most common recommended. The success rate of using an antibiotics to treat SIBO is about 50% or less. If you do an elemental diet, the success rate rises to 72 up to 80% success in eliminating SIBO. For me, it was a no-brainer. I had already gone through a few rounds of herbal antibiotics. I should note you can also do herbal antibiotics. My SIBO was specifically caused by pharmaceutical antibiotics. So I was pretty adamant that I was not going to take an antibiotic to treat something caused by an antibiotic. I did do the herbals, they didn't work. So I think it's really important for people to be familiar with this strategy and the high level of success it has. When you are able to clear out this bacteria, and it can be used not just to eradicate SIBO, but it can also be used for people with Crohn's disease and a whole host of other gastrointestinal problems. The gut is one of the most powerful and impactful organs in our body. I can tell you that the last client that I worked with who had SIBO, when her SIBO was basically gotten under control, she did not need to take her blood pressure medication anymore. Her blood pressure stabilized. Her inflammation in her body decreased significantly. When you are able to get your gut flora balanced, clear out the pathogenic bacteria, allow the detox mechanisms within the digestive system to work properly, people will see dramatic improvements in their health, and the changes can happen while they're still on the elemental diet. For me, within five days of doing the elemental diet, my skin cleared up, my bloating cleared up, a whole host of symptoms that I had had for 2 decades were eliminated. That's how powerful it is. And when you're talking about folks who have been suffering for 20, 30, or sometimes 40 years, going on a liquid diet for 2 weeks doesn't seem that bad if you can get these powerful, impactful results. I think the elemental diet is going to become the standard for treating SIBO in the future because of these types of results and the success rate that so many patients have had doing the elemental diet.
I mean, completely. we're talking about a success rate in the 40s compared to a success rate in the 70s. It is a no brainer. So, transitioning into gut health, do you recommend a vegan diet? And if not, what are your thoughts on a plant based diet for your patients?
Oh my gosh, such a good question. I am, I can tell you before I became a health coach, I probably was more in favor of doing the vegan diet. In fact, before I became very sick with my digestive health problems, I was leaning towards becoming vegan or vegetarian. Since then, I have started to, I was trying to cure myself, I started engaging with a lot of practitioners, right? I started working with nutritionists. I can tell you, I probably worked with either as a patient or as a health coach, at least 6 or 7 nutritionists at this point. None of them have ever recommended I stop eating meat. And I think it's important to understand why that might be. Now, I'm not a nutritionist, but I have talked to several and I work with them as part of working with clients. And I think, well, I'm going to tell you what I heard most recently during my most recent clinical a few days ago. And this came from she's a detox specialist. I can tell you her name is Sinclair Kennelly. She's very good at what she does. And she basically said, okay, this is coming from her, that being a vegan, being a vegetarian is really not the best way to go today. Why is that? It partially is because of the nature of our food supply. So a lot of the foods that vegans in particular eat, soy-based products and other vegetables, particularly soy, are often sprayed with Roundup, glyphosate. Glyphosate is very problematic to our gastrointestinal system. It can cause a lot of damage. Now, it's been well documented that vegans and vegetarians can suffer from B12 deficiency, right? B12 is often found in eggs and meat. And a lot of them take supplements. But if you are eating foods that are damaging to your gut and may be promoting what we call dysbiosis, which is gut imbalances, bacterial growth, pathogenic bacterial growth, you might have a problem absorbing nutrients from your food. And this is where I have actually worked clinically with an individual who was primarily vegetarian. The B12 deficiencies can show up as nerve pain in the body, long-term B12 deficiencies. A long-term B12 deficiency can actually be fatal. So because I've been interacted with so many functional medicine practitioners over the years and nutritionists, I'm going to say that as of today, I don't believe that being vegan is the healthiest way to go. And I should note, for women who are in perimenopause, menopause, and postmenopause, you need protein. Everybody needs protein. And particularly at this stage of life, with the estrogen and progesterone deficiencies, you need protein more than ever, because a decrease in estrogen can affect your muscle tone as well as your bone density. And that you need to consume protein. Most people do not consume enough protein. And so particularly for women who are in the hormonal phase, midlife, you've got to up your protein. And for many people, that may mean eating animal meat. I did have a client recently in the past year who just ate fish. She was pescatarian, and she was having some deficiencies. I mean, these deficiencies constantly come up for people who are vegan and vegetarian, and they can cause cognitive problems. Long-term nutritional deficiencies can cause cognitive problems. They can cause nerve problems. They can cause a lot of serious problems in the body. So again, I think my answer at this point, having worked with so many professionals, is if I meet someone who is vegan, vegetarian, having issues with a pain, nerve pain, I would want to find out if they have deficiencies. And I think I would immediately start to believe they have some deficiencies because they have been vegan, because they have been vegetarian. So, I respect anybody's decision to choose to be a vegan or vegetarian. Some people have very strong beliefs about why they have chosen to stop eating meat. At the same time, when I think about it, I think about that decision not to do that. I do believe that as human beings, we sometimes make very strong decisions to engage with our food because of moral and ethical belief systems. But the biological reality is our bodies need certain nutrients to survive and thrive and live productively. And those needs may not be aligned with an individual's moral or ethical principles, but the biological needs remain. And so, again, I would say I would never discourage anyone from stopping being vegan or vegetarian if they were a client, but I would provide them with education and information to help them understand how it could be risky in the long term if they're not getting the proper support. And there are ways to eat foods that do supplement, the loss of B12. Nutritional yeast is a great example of that. So it's really what I would ultimately say to someone who's vegan or vegetarian is, if you have been vegan or vegetarian for a long time, speak to a nutritionist, work with a nutritionist, get your levels checked, see if you have deficiencies. If you're considering becoming vegan or vegetarian, speak with a nutritionist first. Find out the right foods to eat before you make the decision to walk away from animal products.
Very eloquently put. And as you see on the screen, you put it perfectly. Long-term B12 deficiency can be detrimental and in some cases fatal. After speaking with the providers on DecentMed, I found that for women, especially postmenopausal and perimenopausal and menopausal women, when you have that lack of protein, it can be very detrimental because you also have a lack of estrogen that comes with menopause and postmenopause. I mean, it's the same thing with fasting. My father and I both do intermittent fasting typically. Since I'm on the West Coast, I haven't done it as much, but I try to do intermittent fasting where I don't eat until 12 or 11 a.m. every day, and I stop eating at a relatively early time. For women, it's better to do an intermittent fasting where you stop eating at 6 o'clock and then you eat at 6 a.m. because of the cortisol levels. Right. So you're completely right. The bodies are different. So the way that you can approach a vegan diet as a woman versus a man is completely different.
Yes. And the reality is, I think also that some people can tolerate being on a vegan diet because they have very lean body type. So they don't have a lot of muscle, right? They're just lean people. And for other people, I've met several former vegans, mainly vegans and vegetarians, that they used to be vegan and they became so weak and lost all of their energy when they became vegan that they had to stop being vegan. That's what I'm talking about, the biology of it. The body knows what it needs, regardless of an individual's moral or ethical beliefs. And so the body will tell you if you are not feeding it and nourishing it in the right way. Even if you have a very strong belief that you shouldn't eat meat because you don't want to see animals being hurt, the body will tell you that it needs meat. And I've heard from several former vegans and vegetarians who, had dreams about eating meat, right? Their bodies were craving the nutrients from meat. Now, I will add that as a society, particularly in the United States, we eat too much meat. Most people eat too much meat. How can it be that a lot of people aren't getting enough protein but yet we eat a lot of meat? The short answer from my perspective is gut problems. Gut problems and malabsorption. And malabsorption is basically when you eat food that has the nutrients in it that your body needs, but the nutrients can't get to your body because you have pathogenic overgrowth, you have SIBO, you have some type of gut imbalances, the bacteria in your gut is imbalanced and there's pathogenic bacteria growing. And that pathogenic bacteria is preventing the nutrients from getting into your bloodstream. So we have in the United States, we have people who are technically obese and they have malabsorption, which means they're starving. We have obese people who are starving. That is not uncommon.
Can you touch more on that? That's an interesting point.
Yes. So when people are eating high amounts of processed food and fast food, right? Fast food is processed food essentially, but packaged food, right? Snacks and chips and all of these packaged foods as their primary diet on a daily basis, it damages the gut. It damages the gut. Like they have shown studies that show that it damages the gut lining. It causes, you may have heard this term, leaky gut. What is leaky gut? It's when that very thin one cell membrane that separates our digestive tract from our bloodstream becomes compromised. Holes get poked into this very complex, very thin barrier between our gut and our bloodstream. When that happens, when we start to eat food, instead of that one cell barrier allowing the nutrients to come in properly and keeping the bad bugs that we might be exposed to, our bodies are exposed to, keeping that out of the bloodstream, we're actually eating foods that promote acidity in the body and promote the overgrowth of pathogenic bacteria in the body. When that happens, we're eating foods, typically processed foods are high in fat and high in salt. And they also have a lot of like industrial chemicals that are put in food. Like our government, I'm just going to say it, allows industrial pesticides and chemicals in our food. So this all gets into our digestive system. And so you have the situation that it feeds pathogenic overgrowth of bacteria. They start to take over the digestive system. When that happens, you try to eat food and get the nutrients from that food. So let's say you spent 2 weeks eating junk food every day, processed food every day. Well, let's say a month, just eating junk food, processed food. Your whole chemical system in your body is going to be altered. Your blood is going to become more acidic. Bugs, pathogenic bacteria and viruses and all types of bugs love acidity as opposed to being alkaline. Ideally, you want your blood, your liquids in your body to be alkaline. That's the correct balance to have the correct bacteria. When you're eating processed foods and fast foods, it changes that chemical composition to be acidic. An acidic body attracts bugs. When I say bugs, I'm talking about bacteria that are pathogenic and mainly like just pathogenic bacteria that overgrow. They just love it. So bottom line, what ends up happening is if you stop eating that diet, but you've already developed holes in your gut lining, the holes in your gut lining, which is known as leaky gut, intestinal permeability is the medical term. When you eat food, instead of it being properly, the nutrients properly being put through the bloodstream, what happens is because there are these holes that have opened up in this one cell barrier, food particles fall through those holes, they enter the bloodstream and they promote massive inflammation in the body. So not only do you have an issue where the inflammation combined with the overgrowth of pathogenic bacteria are preventing proper nutrition from getting to your cells, you have an inflammatory system all throughout your body. And you're being fed fat, a lot of fat and a lot of salt. So you are gaining fat, but your body is not able to take in the nutrients to properly feed your cells. Hence, you gain weight, but you're starving. You're nutritionally deprived because your gut cannot properly function. It's been compromised and damaged by these processed foods.
And that makes sense because there's a lot of America that's eating fast food or gas station food. And you couple that with the obesity epidemic, people are eating, but they're not actually getting
They're not getting fed.
or getting fed.
They're
Exactly.
eating, but they're not getting properly nourished.
So, as a health coach specializing in gut health, what is your solution available at robusthealthadvocacy.com? What is your solution to this problem?
So I like to take I call it a multi-pronged approach, because I often feel like, particularly when you're talking about chronic health issues, it's not just one factor that's contributing to that. It is multiple things that are usually happening at one time. So again, meeting the patient where they are, I like to look at what I call the 7 pillars of health. I like to look at their symptoms and talk to them within this framework of the 7 pillars. What are the 7 pillars of health? They're basically core fundamental health elements that if people are able to align with them, it will allow them to heal, and it will be sustained healing that they can maintain throughout the rest of their lives. If you're familiar with the Blue Zone studies that they've done, these are studies that have been done of people who are in their 90s and 100 years old in different parts of the world. So researchers have extensively studied these individuals, and they found consistent patterns in why they have been able to live such a high quality of life for so long. My 7 pillars of health are based on these types of studies. So the 7 pillars are diet, exercise, sleep, stress management, and trauma release. So managing your stress appropriately, releasing trauma from the body, which I specialize in helping people do. Relationships, the quality and nature of your relationships. There's been lots of studies done that show that loneliness is a major risk factor for stroke and cardiovascular disease. So people that they studied in these blue zones that are in their hundreds and in their late 90s, they are usually in a very highly social, communal living environment. They often live with their other family members. They are engaged in social activities every day. And they found that this is a major factor in why they're able to have such a good quality of life at their age. I also incorporate in the 7 pillars personal health advocacy, because being able to advocate for yourself and being able to work with practitioners who are compassionate, who listen to you, who care about you, and want to work with you as a partner in helping you get well is so vitally important to having and maintaining good health. And lastly, I include in the 7 pillars life purpose, which is basically what are the things that bring you joy? What are the things that you're passionate about? What are the things that really fill you up and just make you feel like life is worth living? And unfortunately, some of us are, I think mainly about the job, because I had a very, very toxic workplace for many years. But many of us are working in jobs and having relationships, both professional and personal, that are sapping us, taking away our life purpose, making us feel like we are dead inside. We are lacking that excitement about life. We hate going to our jobs. And so these types of feelings turn into disease. Because again, in the way I work, there's no separation between body, mind, and spirit. what we're experiencing in one of these elements is going to affect the other elements. So I really like to work with clients and ask them these questions. Have you ever sat and thought about what really brings you joy? And if you're in a place in your life where you're not feeling joy, what can you do to change the trajectory of that? How can you make changes in your life to start to incorporate activities that bring you joy? And so they have also shown that having that strong passion and that excitement about life translates into better heart functioning, better brain functioning, and just overall positive health outcomes. So I do work with clients on that, and I incorporate these principles. I've been talking so long, Samuel. Can you repeat the question? I want to make sure I'm answering it.
Yeah, you answered it great. The question
Okay.
was, can you expand on how you help people with that problem? And the way that you do is with your 7 pillars of health, which are on the screen: diet, sleep, stress management, relationships, trauma release, personal health advocacy, and life purpose. And like you eloquently put, regarding Americans, because you're an American and so am I, one of the problems with Americans is related to that life purpose. And that's why when you look at the blue zones, most of them are not in the U.S. because outside the U.S., they do find their purpose in relationships, in helping the family, in helping others. And the one place that does have the blue zone in the United States is the Seventh-day Adventist, where they have that life purpose of serving others, serving God, and working on a community. So I liked how you created that connection among the light, the mind, body, spirit, and how when you have that spiritual health, now you can find a life purpose beyond just your job or making money. I think that's the reason why so many people in the U.S. are unhappy, is because they think that if they don't have money, then they're not worth it, or they can't be happy, or whatever it may be. And because a lot of people in the U.S. have stored trauma, which they have not letting go of. So I didn't know this conversation was going to go that way, but since you do that, can you talk a little bit about what you do regarding trauma release?
Yes, I'm happy to talk about it. I combine it, stress and trauma are obviously two different things, but I do combine them for my purposes because the way that I work with clients, the strategies and approaches that I use to work with them eliminate stress and they eliminate trauma at the same time. What I do, I'm very somatic based when I am engaging with people in helping them deal with their stress and trauma. And basically what that means is I'm body based. So, a lot of people think that stress and trauma are a psychological process, right? You have an experience and then it psychologically impacts you. Well, the research has found that actually, when we're talking about stress or trauma, it is your body, your physical body experiences stress and experiences trauma. And how does it impact the body specifically? Well, if you think about someone who's experienced trauma at a very young age, like before the age they could actually remember it. And I actually have experience personally with this, as well as other people I've worked with. What happens is, as you grow up, you might not even remember or understand what happened to you, but your body remembers. If you may be familiar with this very, very famous book called The Body Keeps the Score. And what does that mean? It means that the body remembers. We may have forgotten about a trauma or compartmentalized it or dismissed it or pretended it wasn't a big deal in our lives, but our bodies don't act that way. Our bodies remember. And so what happens over time is, if you're familiar, there's another famous long-term study known as the ACE study. It's Adverse Childhood Experiences. This is a very well-known study where they've looked at thousands of individuals. They They examined their childhoods. I think they actually interviewed them as children and then followed them as they aged. And they found very powerful pieces of information. One of the things that they found is if for a child that has had what they call 6 or more adverse childhood experiences. Some of those adverse childhood experiences could be growing up with a parent who does drugs, growing up with a parent who is obviously abusive to you, growing up with a parent who has been in prison. There's a whole list of what they call adverse childhood experiences. If you have had 6 or more, your lifespan they have shown, based on the people they've monitored over decades, your lifespan is significantly reduced, and you are significantly more likely to have multiple chronic diseases. So that highlights the fact that there is a strong correlation between experiencing trauma at a young age and having physical health problems, which goes back to what I'm saying about how the body always remembers. So how do I work with clients on this? I have studied several different modalities in working with clients on their bodies to help their bodies release it. So I'll just give you an example of some of the somatic practices. I categorize them in 3 main areas. So you have breath work, which is, I use particularly pranayama breath work. And then I also do trauma-informed yoga. So there's particular trauma movements that you can do to release trauma from parts of the body. Typically, people will store trauma in their back, in their lower back, and their hips. That's where a lot of trauma tends to be stored. And so when you do either the breath work or the trauma-informed yoga, I also use a third modality that I call situational awareness. This was a series of exercises developed by Dr. Peter Levine, who is one of the most well-known practitioners and developers of what he calls somatic. He calls it somatic experiencing. That's the term that he uses for it. And it basically means you put yourself into a physical space that is safe for you, that makes you feel comfortable, and you begin to be aware of your surroundings. Because human beings are very visual, we're very visual as a species. If we start to look at things that remind us of happy times or calming times, being in a room that we are often spend time in, like our bedroom, and we start looking around at photos and pictures and things, it can calm the nervous system, because the mind and the body doesn't know the difference between something we are actually experiencing with our 5 senses and something that we are just looking at or visualizing. The body responds the same way, whether or not we are imagining something or actually experiencing it with our 5 senses. So when we do this somatic experiencing exercises, and there's several different exercises, they are all designed to help us ground ourselves, calm the nervous system, and they also stimulate the vagus nerve. The vagus nerve is a very large body of nerves that really connects our central nervous system to our enteric nervous system, which incorporates our digestive system. It's really, some people call the mind-body axis, gut axis. And so these types of exercises, they bring a deep level of calming to the body-mind. And they allow for the release of trauma. And so I believe in talk therapy. I've done a lot of talk therapy myself. But I can tell you, doing a somatic-based exercise, and I specifically did another type of somatic-based exercise known as EMDR, folks can Google it. Some people might be familiar with it. It stands for, I might get the acronym wrong, it's eye movement desensitization. And I don't remember the last one. I'm sure that you're researching that, Samuel. But the acronym is EMDR, and it is a somatic-based trauma therapy. And I can tell you from personal experience, I did many years of talk therapy, and it was helpful. But when I did, thank you, Samuel, eye movement desensitization and reprocessing, when I worked with a therapist and did EMDR, I felt 40 years of trauma, stress, and fear be released from my body. And it was an incredibly powerful and healing experience. So I would say to anybody who has experienced trauma, particularly sustained PTSD, complex sustained PTSD, to look into somatic approaches, body-based approaches, treatments, and protocols to help release that from your body, because you can eliminate a lot of trauma in a short period of time. And one of the best things about using somatic practices is that you don't have to know what it was that happened. You don't have to remember what happened to you, because sometimes we have experiences as very young children or even in the womb, right? I had an experience in the womb that traumatized me when I was in the womb. We don't have to know what it was that happened to release it from the body. And for some people, this is really critical because they do not have the capacity to go back and reflect upon the deeply painful and traumatic things that have happened to them. But if they can do some movements, if they can do some breath work, and they can release that deep, painful trauma, they expand their capacity and their ability, their resilience increases, and they can get the ability to, if they choose, go back and actually start to mentally and emotionally process what has happened to them. So it is an incredibly powerful, impactful, beneficial way of addressing trauma and stress. Because the difference between stress and trauma is the length of time you experience it. Stress is usually short term, whereas trauma is something that is felt deeply and is held on to by the body and mind. It's also important to note that two different people can go through the same experience, and one person can walk away and not be traumatized, while another person can be deeply traumatized. That also speaks to our innate uniqueness, biologically, psychologically, and spiritually. We are all very different, and we experience life very differently. And that is why we need to treat people as they are. We need to acknowledge their uniqueness, their unique experiences, and the unique way in which they show up in the world and, live in the world. This is, to me, what makes our world so wonderful. We have so many different people who have so many different experiences that we can learn from, and we can become better by engaging through all of these different unique experiences. Now, obviously, we have things in common as well, too, and that can also be a very, very powerful, unifying, healing element.
I completely agree with you, and we could literally do a whole nother hour just on trauma.
Yeah.
Because at our core at DecentMed is trauma. You talked about The Body Keeps the Score.
Yeah.
Available at decentmed.org/PTSD is the documentary. Unfortunately, she made it where it's only available on YouTube, but you can still find it from our website and go to YouTube. And in that documentary, she did a lot of the things you touched on. So day one, we involved cannabis and we did a somatic processing yoga where I had to sit on my feet for a long period of time. And I noticed, like you said earlier, that I was affected in that trauma spot in my lower back. To your point about EMDR, we plan on adding that to the platform. So if you know
Okay.
anyone that does that, or if you want to showcase your work on EMDR on the platform, on our related trauma pages, that would be very ideal. You touched on breath work and pranayama. We feature Ayurveda on our platform and in our Mental Health Matters documentary, which is available at decentmed.org/PTSD. One of our providers, Scarlett D, who is from Austria, she talked about the benefits of breath work for trauma. So I highly encourage everyone to visit decentmed.org/PTSD because that work and trauma that you do and that all of our great practitioners do is immensely beneficial. So, with that being said, my question is how do you bridge the gap between holistic health coaching for gut health related issues like SIBO and people that are seeking trauma? Because what I've found is that there's two schools of thought when it comes to the working woman. And a lot of times the working woman doesn't want to do things that are considered new age or woo woo, whatever it may be. So, how do you bridge that gap with your patients, or I should say your clients at robusthealthadvocacy.com, that need the trauma, but maybe they just came in for gut health or SIBO?
No, it's a great point. And I think what I do is I expose them to the basic concepts of it. I explain how it can really benefit them. And so you mentioned, do I know somebody that does EMDR? And I do. She's an incredibly skilled, compassionate practitioner. I will share her information with you later. But I recently did an interview with her as of this week, and I learned so much about EMDR because she's a specialist in it. But the way that I do work with people is like, now I'm going to share that interview with my clients because she really helped me understand the power of these somatic practices. The other thing that I do is just talk to them. I talk to them about their lives. I talk to them about their life experiences. And as somebody who has gone through some pretty traumatic experiences myself, I'm very sensitive and very attuned to when I am doing my overall holistic assessment of people, how they respond or don't respond to certain questions that I ask that kind of alerts me to, okay, there might be a trauma here. There might be something going on below the surface. Um, the other thing that I do is I just think that because I like to work with people, ideally in coaching over a 12-week period, that allows me a lot of time to get them to know them and to begin to help them understand how some of these somatic therapeutic practices could really benefit them. So if they've never done yoga before, they've never done breath work, or they've never done, the somatic experiencing, they can start to maybe over time become more open to it. Giving them resources and materials, maybe watching an interview, watching a documentary about it. That combined with, I like to also encourage clients who are open to it to do other types of therapeutic activities. I'm a big fan of having people spend time in nature because it is something that most people are okay with doing. And it's usually something they've done before, right? And I also feel like it can help open them up to exploring other types of modalities because, again, anything that calms the nervous system and allows people space to breathe and to kind of reflect and to assess the state of their lives, and to have gratitude about where they are in their lives is something that can make them more resilient and can open up space within their hearts to begin to be more flexible and more open. I feel like the one big thing that can really help people is when you're in the process of working with them, you're able to alleviate that pain, whether it is a physical pain or an emotional pain. And I usually see them as connected, being connected. Physical pain is often tied to an emotional pain. Having a chronic disease can be a form of trauma. Being sick for decades, the difficulty of that, the physical pain involved with that, not being understood by doctors for decades, that is a trauma. And so really, again, sitting with people, understanding their stories, listening to their pain, acknowledging and validating their pain and their experiences, that builds trust, that enhances the quality of the relationship, and it allows people to feel safe and to be more open to trying different things that they may have initially said, this is not for me, and I'm not going to do this, and this is too woo-woo or whatever.
Okay, thanks for sharing. So next thing what I want to do is I want to have you walk me through your programs.
Okay.
So we'll start with the first one here, the health video series. My encouragement is to put that in our CRM, and I can walk you through how to do that later. But what does the patient get or the client get in this health video series?
So it's not just one series. I've actually recorded, as of now, 4 different health series. They are focused on my areas of specialty: gut health, personal health advocacy, hormonal balancing. And I just completed a shorter series that covers the 7 pillars of health that I talked about earlier.
Mm-hmm.
And these series, I kind of do, depending on the depth that I'm focusing on, like with the gut health, the personal health advocacy, and the hormonal balancing, I do a pretty detailed examination, review of the topic. These particular series typically last from 4 to 5. They're 4 to 5 individual video sessions that last about an hour each. And so I look at the core elements of the topic. For example, for gut health, I get into the details of how does our digestive system help us? Why is our digestive system such an incredibly amazing and powerful organ? Whether you're talking about hormones, 70% of our hormones come from our gut. Our gut is the core of our immunity. Our gut is the core of our mental stability because of the different hormones. Serotonin comes from the gut. So I cover all of those kind of like physiological elements. And then I get into what is a healthy gut functioning? What does healthy gut functioning look like, right? To give people an idea of like, where do they sit within this realm? I talk about the Bristol stool chart. I encourage people to look at their poop, right? I consider that an important diagnostic tool that you can do every day. I know it sounds gross, but it can be incredibly important to understand how you are functioning, how you are eliminating waste on a daily basis. How does it feel? Do you have pain? What does the stool look like? What does it smell like? All of these things are things that you can do every day to kind of assess the state of your physical health. I also look at with gut health, the things we talked about with the processed foods. What do those foods actually do to your gut? What are the health consequences of your gut being damaged by these foods? So helping people recognize that if you have chronic skin flare-ups, that is one of the symptoms of having leaky gut. It's actually tied to your gut. It's actually tied to your immunity. Your immune system is on high alert. And it's usually because you have SIBO, you have an overgrowth of pathogenic bacteria, you have leaky gut, and it is affecting your entire body. You're having systemic issues, but they start in the gut. And so I just cover all of these kind of main areas. You know, what is for hormonal balancing, I look at what are the key hormones that are impacting a woman as she goes through perimenopause? What is perimenopause, right? What is involved in perimenopause? What's involved in menopause? These are things that many women sadly do not know. They do not know why they have certain symptoms. The most tragic part, I think, of doing the research for the hormonal, I call the series hormonal transitioning, the perimenopause, menopause, postmenopause series. The saddest part of doing that research was learning that, number one, most women blame themselves when they start having symptoms, whether it's the brain fog, the night sweats, the hot flashes, the bone and muscle aches. They say that they're like, what's wrong with me? Why am I falling apart? What is it that I'm doing to cause this? This is a biological process that all women go through. Yes, not all women are going to have all these symptoms, and they might not have debilitating symptoms, but all women go through perimenopause, menopause, and postmenopause. But women feel incredibly alone and isolated. And the other two sad statistics that I learned about doing this research on hormonal transitioning is 90% of women go through perimenopause, menopause, and menopause, never speak to a doctor. They never speak to anyone. They keep their suffering to themselves. They suffer silently. The last statistic that was one of the saddest was that up to 40% of women will leave their jobs because they cannot handle being at work anymore because their hormonal symptoms are so severe that they are unable to function. So they just leave, they walk away from their careers for over something that could be treated fairly directly and would allow them to maintain or restore their quality of life, stay in their careers, continue to contribute. You know, when you think about somebody walking away from a job, whether they're male or female, you're talking about losing money. That is a loss of money for a family, right? That's huge. Plus the fact we're losing the brain power, the creativity of women at this stage of their lives over something that could be treated, and they're not talking about it. There's a stigma associated with it. So I talk about all of these things. I talk about all the things that a lot of people hold close to themselves. They feel ashamed. They feel deeply ashamed about having hot flashes, night sweats, brain fog, and I just put it out in the open. There's nothing wrong with you. This is a physiological process, and you deserve to get help. You deserve to be treated so that you can be restored. Your health can be restored. And of course, I also talk about with the hormonal transitioning, the more serious consequences that can happen, particularly starting when women are entering their 60s and 70s, after they've gone up to sometimes 30 years without estrogen in their body. They start to have sometimes the risk of brain problems, dementia and Alzheimer is very high because of the loss of estrogen. There's also a significant risk for heart attack and stroke because of the loss of estrogen. Every organ in a woman's body has receptors for estrogen. It is one of the most important hormones for women. And so when those estrogen levels drop, not only do you have those symptoms, which those symptoms often happen in perimenopause, but they can continue right throughout postmenopause. They can last for up to 20 to 30 years. The symptoms can then become consequences, which can be fatal. And again, women are not getting this information. A lot of them are going on social media, which may or may not have accurate information. I talk about all of those things. The webinar series is incredibly, I think, broad, within that topic, and it allows for a lot of, I would say, thought-provoking pieces of information that women may not have heard from their doctors.
And question, Angela, because I'm looking at here, you have
Yeah.
the 12-week health program, and then you have the 6 and 12-week coaching. Can you
Yes.
walk the audience through what the difference between the program is and the coaching?
Yes. So I should note that I am not doing 6-week coaching. I put this on my website initially, and then I was talking to practitioners and really, because every week I'm literally doing clinical training. I'm sitting in on webinars. I'm learning about the latest innovations in my areas of specialty. And what I learned is that you cannot resolve some of these chronic health issues with a client in 6 weeks. You cannot effectively resolve it, right? So I would just tell people for the time being, I'm going to update this page, but for the time being, just disregard that 6-week coaching. Now, the difference between the program and the coaching for 12 weeks is I am offering, starting this fall, a 12-week robust health program. It is a group program that you can enroll in. And what it includes several elements. So it's going to be a series of modules, and it's going to be covering 12 different comprehensive topics, including some of the 7 pillars. It's going to include all the 7 pillars, actually, but it's going to go past the 7 pillars to include a lot of other topics. And so what people will get for this 12-week program is you're going to be looking at every week recorded modules. Every week, I'm going to be facilitating a live session based on each week's module, which will include answering questions. We're going to have a community so that when you join this 12-week program, you're going to be put into a community of other women who are going through the same thing that you're going, or at least having that on that same life journey. It's really designed for, again, high-performing women who are running their own businesses, who are at the stage in their life where they're trying to take things to the next level, and they absolutely feel crushed and diminished by their hormonal symptoms. They are not able to think clearly. They have severe fatigue. They have bone and muscle pain. They have night sweats. And it is really not only diminishing the quality of their lives, it is keeping them from being able to continue to be the high achievers that they are in life. And so this program will also include, like I said, it's going to be a community platform that they will be able to participate in, share ideas, share experiences, build camaraderie, and get another level of support on their healing journey. Going to the 12-week individual coaching, so that 12-week one-on-one coaching is really what I would call, again, when I'm talking about meeting clients where they are, it's really about developing highly personalized, customized coaching that is specifically aligned with the individual's health needs. So whatever their health concerns are that they're bringing to me, I'm going to do a very extensive assessment and analysis of all aspects of their life. And then I'm going to write a report that summarizes and highlights some of the key areas of their life that their health concerns, in terms of their health concerns, those priorities, what are they? Then I'm going to develop a very customized response to helping address those particular health needs that will oftentimes involve doing labs and working with their primary practitioner. I also have a network of my own, relationships with practitioners. So if a person doesn't have a particular practitioner that they're working with closely with their chronic health, I can recommend people. I also work very closely with certain nutritionists in particular to help women assess their hormone results if they don't have a doctor that's familiar with some of the functional medicine tests. I know functional medicine doctors that they can work with. So again, I do work with licensed practitioners as part of a team with the individual. But my main contribution is helping the individual in the one-on-one coaching learn about their bodies, understand their health conditions, and develop lifestyle and behavioral changes to complement and enhance any treatment protocols that they're getting from their regular doctor. So it is a much more intense, extensive, customized experience that covers, again, the gut health, the hormonal balancing. I would say no matter what the client is dealing with, I will usually always have some supports related to gut health, because like I said, gut health is so foundational to virtually every function in the body. And it impacts virtually every function in the body. We're talking about blood pressure, blood sugar, hormones. I mean, it's just covered so many areas. So when you start with the gut, and that's where I usually like to start, what is going on with someone's gut health? What's the status? And then that, of course, that's tied to diet. How are they eating? I always want to start there foundationally, because that's where you want to, it's like it is the foundation, and then you want to build from there and address whatever other health needs come as a result of that. It is amazing how many chronic health conditions can be eradicated or significantly reduced by addressing these lifestyle related issues, the 7 pillars: diet, sleep, exercise, relationships, stress release, stress management, personal health advocacy, and life purpose. People who have been sick for decades can either eliminate or reduce significantly their chronic health problems by aligning with these 7 pillars. And that just goes back to that statistic. 80% of all chronic disease is preventable. And we as individuals have the power within ourselves to affect change positively with our health. Coaching really is ultimately at its core, health coaching is really helping individuals realize they have the power to make changes in their health and to maintain those changes for long-term positive health outcomes.
Thank you so much for joining us today, Angela. This has been our latest episode of DecentMed Showcase Robust Health Advocacy. Her SIBO page, as well as Angela's updates on our website, will be available soon. Visit robusthealthadvocacy.com and connect with Angela. Thank you, and everyone have a great rest of their day.
Thank you so much.